And welcome to this evening's Maternity and Midwifery Hour. And apologies, we're a moment or two late, but we had a few technical glitches, but we're all back on square one now, so we're fine. And thank you so much for joining us this evening. I hope you're going to enjoy what we're going to be talking about. It's the fifth series. I nearly said fifth episode. We're session, I think, 4 now. So welcome to you all from wherever you are. And I know we have people from all over the UK and from parts of the world as well, all over the place, which is lovely. So welcome from wherever you are and whatever time it is. And as you'll know, my name's Sue Macdonald, and I'm the curator of these Maternity and Midwifery Hours, as well as the Maternity and Midwifery Festivals. And it's my pleasure to be chairing this evening. So I'm really excited about the content today. It's going to be really interesting. As many of you will know, these sessions were started last year in April, beginning of April, I think it was now. And the whole idea was to provide continuing professional development for midwives, for student midwives, for people who wanted to become midwives, for mums, for medical colleagues, for maternity care support workers, really to help connect, because it was a very difficult time. And I know it's still a difficult time, but it was a difficult time last year, and people did feel a bit distant and sort of split up a little bit, and this was a way of getting information and some education out. So these are accessible. They're accessible now live, and also you'll get them on your recording after Friday, and you can access them through the Matflix package as well. So, and that's all free and it's all accessible. So anyone who's doing any courses or studies and you need some up-to-date information, this is the place to come. And thanks to Matflix, who do the video streaming from the maternity experts, all the CPD, everything for your revalidation also, this is the place to go. Now, this evening, I am delighted to be joined by 2 experts. I have Emer Gilligan and Claire Ryan with me this evening, and we're looking at the microbiome. I'm sure I pronounced that incorrectly, and Claire will put me right, and its benefits to the baby, and a little bit about the WaterWipes and what they get up to in the study that they've recently done also. But we always start, and we like to put our presenters on the spot and ask them a really difficult question, their moment of the week. And I'm going to start with Claire for a little moment of the week to share with us. Welcome, Claire.
Hi, Sue. It's nice to be here. Oh, sorry, I might just go ahead.
Yes, you have to go ahead. You have to go ahead.
Sorry about that. Okay, so my moment of the week was on Saturday, and I met up with some friends. We did a Pilates class, and the actual moment was sitting in a coffee shop after we'd done our exercise class and just chatting. You know, in Ireland, things are still, I think, a bit further behind with COVID and things like that. So the possibility to be indoors is somewhat novel. And the 3 of us just sat and righted the world, of course. So it was really enjoyable, really relaxing, and it felt like old times.
Wonderful. And is it lovely that, I mean, the horrible thing is COVID, but the good thing is that we've learned that we've taken a lot of stuff for granted. And so when it happens, it's so delicious.
Absolutely.
Wonderful.
Yeah.
Okay, thank you for that, Claire. How about Emer? Have you got a moment that you'd like to share with us?
Well, I was thinking about that, and I was thinking, well, my moment of the week is yet to come. I do a yoga class every Friday morning, and it's a lovely chill out time where I don't think about work, I don't think about the family, I just focus on the teacher and going through the movements, and it's a lovely time to relax and take in what has gone past in the week and looking forward to the weekend. So
fabulous. What a good idea to have it on a Friday. Fantastic.
Yeah, it's lovely, yeah.
Wonderful idea. Now we can all learn from that, because things like Pilates and yoga and a bit of exercise we've talked about before on this show, and it's a really good thing to be able to get into and try out. So thank you for sharing that. It's fantastic. Okay, I'm just going to do a little bit of good wishes to those people who are going through the COVID. I'm thinking about the people who are poorly with COVID and who are caring for people who've got COVID, either the COVID itself, or long COVID, which is pretty hefty to experience, obviously. So we're sending some healing thoughts through to everybody in that situation. But also, of course, it's having the impact on the people who are in the service, in the maternity services, in the health service itself, looking after people when they're a bit short-staffed and everyone's very stressed. So I think we need to say a big thank you to everybody, but also fellow feeling, because we know what it's like when you're kind of having to work and keep everything going. So thank you for that. And we know that midwives particularly are under a huge amount of pressure at the moment. So you really need to look after yourself. So maybe Emer's idea of the yoga is a good one, or Claire's idea of being able to meet with some friends, obviously using your masks if that's required for coffee or whatever, because that's very important to us as human beings, really. Now, I was looking through the news because I always like to share a little bit of news. I'm kind of the top of the news. It just seems to all be about the petrol crisis, problems, whatever. And we hear it's all easing, which is a good thing. But of course, that's an additional stress for those of you who are, say, on the community and having to get fuel in so you can work. So another fellow feeling for everybody there. Little news that COVID work's underway to offer frontline staff their COVID booster. So I know that some colleagues have already had their booster, which is great. So it keeps everyone as healthy as they can be. It's interesting, actually. I did get something on, and I can't remember now if it's Facebook or Twitter, but somebody was saying they had a really horrible cold. And there's a whole discussion about this whole year and a half, almost 2 years, where we've been wearing masks and sanitizing our hands and doing all the things we should do. It actually means that when we stop doing it, we're at greater risk of picking up things like colds. So I think we need to carry on being a little bit cautious. Maybe the hand washing, certainly all the research says that masks reduce the infection, whether it's colds or corona or whatever. And let's try and stay as healthy as possible. So it seems to be a prevention evening tonight, because I'm also saying don't forget your flu vaccine, also because that's going out at this time of the year. Now, coming up on the 9th to the 15th of October is Baby Loss Awareness Week. And I understand there's a candle event online. I think Tommy's, the charity, are running this or highlighting this. And the idea is to light a candle in the evening around 7 p.m. to honour every small life that's been lost, which I think is a lovely thing to be able to do. We'll remind you that this next week as well, so you don't get it forgotten. Also, NICE, the National Institute of Health and Care Excellence, have released a draft guideline consultation document on employers giving skills to support employees with mental health issues. Now, this is an opportunity for me just to remind you all that there is a set of resources. I've got some references on there, and I've included the NICE consultation there as well, which may be of interest to some of you watching, hopefully. And last week I shared my book that I was reading, which I put somewhere, my book. I'm still looking at it. It's still really good, Nurturing Maternity Staff. So well done for Jan Smith for doing that, and her colleagues as well. But also it seems to be, for me, a sort of video week. And I'm not talking about the James Bond film here, because that's not yet on video that I know of. But I'm talking about, there's a really brilliant video called Physiology of Childbirth, and I've put the link on the resources page. And this has been led by Anna Byram, who many of you will know, and her team. And it's about illustrating the birth and how we as midwives especially can influence physiology, the touch, softened lights and privacy. It's a really nice video. It's only 4 minutes, and it's really worth looking at for all of you watching here tonight. The other thing that's coming up is Respectful and Safe Maternity Care. And this is a new webinar series from International Childbirth Initiative. And again, the link is on the list of resources, which started this week. And it's just there, again, they're very short clips, but they just remind us of important things. And for me, it reminded me of how lucky we are and how we mustn't take for granted the service we have and the care we can give women in this country. But even though we don't always get it perfect, we can keep trying. So do have a look at the resources page. Well, now I think it's time to move on to the meat of the session, or the main vegetables of the session if you're a vegetarian. Forgive that analogy. I'm really delighted. We're going to be looking at the newborn baby, and we're looking at the microbiome and as well as the baby's skin and skincare, which is really important for the newborn. And for this content, I'm delighted. I have two excellent speakers. I have Emer Gilligan, who's there, and she's currently the regulatory manager in WaterWipes and is responsible for the safety and compliance of WaterWipes products. So there's a huge role. She's over 10 years experience in the cosmetics industry, where she's been heavily involved with researching skincare needs and cosmetic ingredients with a focus on safety and ingredient safety and the impact on the skin. She's got a degree in pharmacology and a PhD in molecular biology, which together with her experience has enabled her to have the additional qualification of cosmetic safety assessor. So that's Emer. And then we have Claire Ryan there. She's a registered midwife and studied midwifery at Trinity College in Dublin, graduating in 2012, and she's worked as a midwife in both Ireland and Australia, where she also worked as an associate midwifery unit manager. And as she has a passion for infant and parent care, which is great, Claire joined the WaterWipes team in 2021 as medical science liaison, providing education and support to the healthcare professionals to ensure safe and effective cleansing of babies' delicate and sensitive skin. Her role is central to the company's medical team as the brand continues its commitment to continued research and development to promote and enhance infant skincare. And she's going to be talking about the microbiome, which I'm looking forward to. And at some point, we're going to have a little poll. So watch out for that, it's coming. And so you'll be able to participate in that. So welcome to Claire and Emer. And I will say though that welcome, the screen is yours.
Okay, thank you so very much for that lovely introduction. So good evening everyone, and thanks again for the opportunity to present this evening. And so this evening's talk then will be on baby skin microbiome. Next slide please. So my first few slides will quickly recap the basics of skin physiology before delving into the topic of the skin microbiome, with an emphasis on the baby skin and the latest research that's available. At the end, I've included some considerations for care and how a minimalistic approach could be beneficial to the microbiome. Next slide, please. Okay, so the skin is the body's largest organ, and it has three primary functions: protection, regulation, and sensation. The stratum corneum is the outermost layer and acts as a protective barrier against microorganisms, chemicals, and allergens. Next slide, please. If you compare a baby's skin to adult skin, babies have a 20% thinner epidermis and a 30% thinner stratum corneum, so much thinner than an adult. Next slide. And they also have smaller corneocytes and less natural moisturizing factor present in the stratum corneum. And because of this, there's a faster rate of water loss from a baby's skin, so more prone to dehydration. And this results in a less effective skin barrier function. Next slide, please. So as a baby grows through the first 12 months of its life, the skin continues to develop. The barrier function of the epidermis and the stratum corneum gradually increases. And by 12 months, the skin barrier has matured enough and the water handling function of the baby's skin has been optimized. Next slide. So we now know, and this is a rapidly growing area, that within days after birth, or the baby's skin is exposed to a variety of maternal and environmental microbes that rapidly colonize the skin surface. And so this whole area is the area of the skin microbiome that we're hearing more and more about. Next slide, please. And so what the microbiome is and what it usually refers to, it's a term that includes microorganisms, their genomes, and environmental conditions in which they live. The microorganisms vary between different individuals and different skin sites on the body, and it differs a lot between adults and children and newborns. The majority of the bacteria on the skin is commensalistic, which means it doesn't help nor does it harm the skin. And the other part of the bacteria is mutualistic, which means it helps the skin and it benefits the microbes themselves that live there. Next slide. So some of the latest scientific research suggests that the establishment of microbial communities begins in utero, and that this may prepare the infant's immune system for the challenges of the external environment when it arrives. However, much more work needs to be done in this area, as this currently is only in a hypothesis and is contested by some people who believe that in utero is sterile still. Next slide, please. So the first major microbial colonization of newborns occurs at birth, when newborns are seeded with the mother's microbiota. Infants, if you click, more information comes up. So infants born via C-section are typically colonized by commensal skin bacteria, while infants born via vaginal delivery are typically colonized by vaginal microbes such as lactobacillus. But the evidence in the literature suggests that these initial differences disappear within a month of life, so that there is no real difference after 4 or 5 or 6 weeks with the bacteria that's on the skin. And the fact that this initial difference disappears after 1 month questions the techniques of vaginal seeding, where gauze swabs are placed in the vagina during C-sections and rubbed onto the baby's body and face after birth, with the idea to transfer the microbes they would have been exposed to had they been delivered vaginally. Next slide, please. So at birth, the microbiome on the skin is homogeneous and not site-specific, unlike adults. If you click again. So the table on the right shows that in the neonate, bacteria is not differentiated by site, as there's no difference in the amount or the type of bacteria present in the nose, mouth, or skin. So if you look at the section highlighted in blue, you can see that lactobacillus, Gardnerella, and all of the other bacteria are all pretty much the same when you look at the nose, skin, or mouth of the neonate. However, if you look at the mother, you can see that Streptococcus is largely specific to the mouth, Carina bacteria is specific to the nose, and Propriana bacteria is specific to the skin. However, it does seem that bacteria begin to demonstrate body site specificity within a few days to weeks after birth. Gestational age at delivery also seems to impact the skin microbiome, with full-term infants exhibiting an increase in the different types of genre present, and preterm infants having fewer genre present. Some suggested reasons for this may be that the skin is not fully developed, mode of delivery might have an impact, the use of antibiotics, or even the hospital environment of where the baby is sleeping or lying. So within the first year of life, the number of bacteria genre does not change, but the relative abundance of the genre fluctuates. So next slide, please. So, no, sorry, the one before you. So as a child grows, sorry about this, as a child grows then from infancy to adulthood, the composition of their microbiome evolves. The healthy pediatric skin microbiome is distinctly different from adults. And similarly, the contribution of microbes to pediatric skin disease may very well be unique as well. The diagram then on the right highlights the changes in bacteria present on the forearm of an individual over their lifetime. So in the beginning of life, when they're between 0 and 6 months old, the forearm is dominated by 3 different genera. As the child grows, these 3 genera become more abundant, and more genera are detected again in greater abundance. And at puberty, the forearm skin microbiome stabilizes and becomes less diverse. Next slide, please. There are many factors that influence the skin microbiota, and some of these include gestational age, parental skin, feeding type, environmental surfaces, and caregiving equipment, as well as antibiotic use. So this diagram shows a list of prenatal, neonatal, and postnatal factors that contribute to the bacterial gut composition in infants. So there's a lot of information in the literature about gut microflora as well as skin microbiome. So early life is a critical period for the establishment of both the microbiome and immune responses, and it seems to have long-term implications for health. Next slide, please. So then dysbiosis occurs when the skin microbiome is altered from the normal healthy microbiome. It's often present in many skin pathologies, including atopic dermatitis and nappy rash. Damaged skin has a decreased bacterial diversity and often an increase in the presence of Staphylococcus aureus. And Staphylococcus aureus is the dominant microbe in atopic dermatitis. And in nappy rash, Candida albicans and Staphylococcus aureus are most frequently isolated from the affected area and are therefore thought to have a predominant role in nappy rash. So this dysbiosis may be occurring because of an imbalance in your skin microbiome or in the baby's skin microbiome. Next slide, please. So as I mentioned earlier, early life is a critical period for the establishment of both the microbiome and the immune response, with long-term implications for health, and disruptions in the skin barrier function and early colonization predisposed to local and systemic immune dysregulation. So this dysregulation is implicated in eczema, food allergies, asthma, and potentially other inflammatory conditions. So understanding the modulating factors during this period could lead to targets for disease prevention in the future. Next slide, please. So over the past 2 decades, consumers have been educated in performing extended beauty and cleaning regimes for themselves and for their family, with numerous personal care products for both themselves and their families. And this has led to the skin microbiome being put under severe stress, where excessive personal hygiene will wash away microbes. Exposure to preservatives from numerous personal care products can kill the microbes. pH of products may adversely affect the microbiome. Abrasion by rubbing or clothing may remove microorganisms, and too much desquamation, which is the shedding of the skin, will result in the shedding of the microbiota as well. So what's the answer? And I suppose more and more people are coming out that less ingredients and simpler routines seems to equal less potential microbiome interference. Next slide, please. So timely and proper establishment of a healthy skin microbiome has a pivotal role in denying access to transient, harmful, and potentially infectious microbes. The early period in skin development could affect long-term microbiome stability. In adults, sensitive and irritated skin is a rapidly growing problem. Reports of sensitive skin have increased by more than 25% in less than 20 years. And we all know that sensitive skin is more prone to infection. And the pediatric skin microbiome is a largely understudied area, but it does provide an exciting area for future research, which I'm sure we'll hear more about in the next decade. Thank you.
All right. Hi. So thank you, Sue, and thanks, Emer. That was really interesting. I'm Claire. I'm the medical science liaison at WaterWipes, and I'm also a registered midwife, as Sue explained earlier. So It's lovely to be here this evening to discuss the differences in baby wipes. I'm going to briefly discuss the different ingredients in baby wipes and what they do. And then I'm going to talk to you about a recent study that was completed on the impact of different baby wipes on newborn skin. Sorry, first though, as promised by Sue, we have the first of two polls. So I'd like you to answer the following question for me. Do you think that the brand of baby wipe used can impact the incidence of nappy rash? So if you can click A for yes and B for no, and we'll have a look back on the results of that in the next few minutes. But this evening, I want to talk about baby wipes because recent articles recognise that the use of baby wipes has become increasingly common for cleansing diapered skin. And I've seen that in my own practice where parents were coming in with baby wipes to use on the postnatal ward. And, you know, I've heard it from a number of colleagues also. Some studies hypothesize that this might be because parents don't fully trust or have confidence in the use of water alone as a cleanser, while other studies found that parents report that using baby wipes were more convenient to use than cotton wool and water, particularly when they're outside of the home. Healthcare providers, including the NICE guidelines, have traditionally advised water only with cotton wool and, or cloth for cleansing the sensitive newborn skin. But with more parents opting to use baby wipes, what advice can we provide to them about that? So the sheer choice of available skincare products can make it difficult for healthcare providers to recommend specific products over others, and for parents or carers to make informed decisions on how to safely cleanse their baby's skin at each nappy change. Given what we've just learned from Emer regarding the skin microbiome, we can understand why it's recommended that any kind of topical agents that are used for bathing and cleansing newborns and infants should not adversely alter or affect the protective skin barrier. And this means using products that are pH suitable, they're fragrance and alcohol free, they contain only a mild preservative, and where possible have minimal ingredients. So with this in mind, WaterWipes recommend that parents and healthcare providers flip the pack on baby wipes or the baby product that they're using. Flip the pack and have a look at the number of ingredients included in the product, and also if they recognize, you know, what those ingredients are and what they do. So it might surprise you to learn that wipes that are marketed or advertised as being pure have a minimal or an average of 7 ingredients in them, while those marketed as being natural have an average of 10 ingredients in them. And considering how much the chemical composition and even number of ingredients in baby wipes can vary, it can be helpful to know what these different ingredients do and what they're used for. So surfactants you'll find in most baby wipes, they're added to many baby wipes to decrease the surface tension, and that allows fat-soluble impurities to be removed from the skin surface. The interaction of cleanser surfactants with stratum corneum proteins and lipids can be deleterious to the skin. And this damage can provoke scaling, dryness, tightness, erythema, and swelling. Similarly, some wipes will have fragrances include them in them, and products may still have a smell if they're labeled fragrance free, but they should be free of added fragrances. Some are, you know, marketed as unscented, and that means that the product has been formulated to have no scent, but ingredients may still have been added to mask the odor of the formulated product. And fragrance can cause and worsen itch on the skin, and it can also provoke irritation or allergic responses on contact. Other ingredients included in wipes include emulsifiers, and they mix and disperse the many ingredients within the product. There are solvents that are used to help to dissolve the ingredients. Buffers are used to help to maintain the pH of the product, and then viscosity agents are used to help to control the feel and the thickness of the product as well. So By contrast, water wipes are made using only 2 ingredients: ultra pure water, which is water that passes through a 7-step water purification process. It uses a series of filters to remove impurities. It softens and purifies the water. This purifying technology provides increased wettability of the wipe, which allows it to access more dirt and impurities, and provides a deeper and more effective clean when compared with cotton wool and water, and also without the use of those additional surfactants that we were talking about earlier. The only other ingredient in water wipes is the grapefruit seed extract, which helps to maintain the integrity of the skin and acts as a protective barrier and a natural skin conditioner as well. It's also used as a mild and natural preservative within the product. It's a naturally derived extract, and it's rich in vitamin C and has antioxidant properties as well. So I know that it's been a while since I asked the poll question. So if we can look back at the results, please. Okay, so 88% of people think that the different brands of baby wipes can impact the rate of nappy rash. And there was a study recently done, the BASIC study, which sought to look at that exact kind of question. So the BASIC study, or the Baby Skin Integrity Comparison Survey study, was carried out in the University of Salford, and it involved a total of 698 mothers and babies. The aim of the study, as I kind of alluded to earlier, was to establish if the different formulations of wipes would impact the skin integrity of newborn baby's skin. So the participants were broken into 3 different groups. They were all given the same brand of nappy to use throughout the study, but within the 3 different groups, they were assigned one of 3 different brands of baby wipe. All of the baby wipes were readily available in the supermarket, and all were marketed as being gentle enough for use on newborn skin. One of the products was WaterWipes. And so the trial ran from birth up until 8 weeks old, and the results showed that babies who were cleansed with water wipes had a lower incidence of nappy rash than those cleansed with either of the other brands. And you can see the results there, 19% versus 25 and 30%. The study also showed that babies who were cleansed with water wipes had also had a shorter duration of nappy rash than those cleansed with either of the other brands. So for each day of nappy rash experienced by a baby who was cleansed with water wipes, the rash would have lasted 50% longer had they used either of the other brands. So I have one last poll as well, if you don't mind. I'm keeping you busy. But basically, I just want to know now, given what you know about baby wipes, do you consider water wipes to be the purest baby wipes, the world's purest baby wipes? So A would be for yes, and B is for no. Finally then, I just want to make you aware of the Pure Foundation Fund, which is launching for the second year on the 8th of October. So the Pure Foundation Fund is a grant program that celebrates and recognises the incredible work of healthcare professionals involved in bringing new life into the world. This year, we will be awarding we'll be providing awards for 3 different areas. So we'll be celebrating midwives, a pediatric or neonatal nurse, and then health visitors as well. And so we would encourage you to submit a nomination for yourself or for a colleague who has gone above and beyond in their practice over the past year. I think given the year that we've had, there's going to be no shortage of worthy nominees. But yeah, we would encourage you to get those nominations in. Patients or mothers can also nominate a healthcare professional as well. So you can do that, submit your nomination on the WaterWipes website. And as I said, that opens on the 4th of October. So that is all for me. Just to finally kind of mention that if you have any queries, you're welcome to email us at hcp@waterwipes.com. Go onto our website to get your nominations in, and you can sign up to our newsletter as well, where you'll hear about any news or events that we've got planned. But that's all from me. Thank you very much. Oh, sorry. Okay, brilliant. Great to hear. I don't know if everyone else heard that, but 85% yes and 100% yes. So that's a great overall result in WaterWipes being the world's purest baby wipes. Thanks.
And thank you to everyone who participated in the polls. And many thanks, Claire and Emer, for those presentations, which given us all something to think about. So if you're joining us now, this is the Maternity and Midwifery Hour with me, Sue Macdonald, and Emer and Claire. Just a quick reminder to you all, if you're listening and you have a question, now's your chance to put in a question. Now I'm looking this way because I have two screens and the questions for the speakers come through on the my right hand side. So you've got a minute or two to put some questions in. Someone is waiting to take your question as we sit here. I just wondered, actually, Emer, I don't know if this is a question for Emer or Claire, but no, I think it might be Claire. I just wondered if in the study with the 3 groups of wipes that were used, were the participants, the mums, blinded, or did they know which wipes they were using?
Okay, yeah. So unfortunately, the mothers in the study, they weren't able to be blinded, just because it was felt that had they done anything to blind the participants, that it would have impacted the quality of the wipe. But the people who were conducting the study were blinded to the different brands assigned to each mother.
All right. Okay, that's interesting. Okay, thank you for that, Claire. I've had a question from Helena White, who says, do you think it would have been useful to include a group of mums using cotton wool and water to compare? Because I mean, that's a very traditional, what we used to be teaching mums and still do in some units.
Yeah. In terms of, the paper, it does touch on the fact that there have been, I suppose, a number of studies now that have, tested, I suppose, the baby wipes against cotton wool and water. And there's been another number of studies that have shown that baby wipes are appropriate for use against, cotton wool and water. And so in this kind of situation, they I suppose decided against including the use of cotton wool and water.
Okay, well that's very helpful. Thank you for that. I'm looking again because I've got a question from Jo D'Augustin. Hi, Jo. She says, thank you, Claire. I was pleased to watch this briefing. I'm glad to see this product on the market. But thinking from an environmental perspective, and I'm sure many practitioners are very aware of this, how green is the wipe itself, please, and the total manufacturing process? And do you have a plan in place to improve the environmental impact of your product? She's still thinking about whether single-use wipes should be used at all. And I've seen the info read biodegradability also. Thank you.
Yeah, so the wipes are now biodegradable, and they're biodegradable within your home compost as well as industrial compostable as well. Good. In terms of the packaging isn't biodegradable at the moment, but it's something that we're always working towards. The thing about our product is obviously it contains only 2 ingredients, and so we never want to do anything that's going to impact the product, impact the quality of the product or anything like that. So it may take a little bit longer, but it's something that we are working towards.
I guess it's difficult because the container itself has to be of some sort of product that doesn't leak or let anything in or letting anything out, I guess.
Exactly.
Yeah.
Exactly.
Certainly there are many projects internally looking at the film, but the primary project that we rolled out was the move to biodegradable, and that had to follow a full suite of testing that took over 9 months to conclude, and it looked at the material characteristics, the biodegradability, the disintegration of it, and the compostability. So it was a holistic kind of look at the biodegradable and compostability.
Okay.
And so it successfully passed that.
Okay, I'm wondering, I mean, when you say compostability, I'm sure there's going to be some people listening that think, oh, should I put that in the compost? But of course you can put lots of things you can go in the compost.
Yeah, I suppose the reality is when you're changing a diaper, it goes within the diaper. But if you use it to clean hands or face or a surface, it can actually go into your home compost. And we have the tests to show that it is suitable for home composting.
Right. Okay, thank you for that. I've got lots of questions coming through. Helena White, hi Helena, is saying, I'm also wondering if Emer could advise the best time for the baby's first bath in terms of disrupting the microbiome, and should they add anything to the water? Sometimes water alone can be dehydrating.
Look, I suppose I'm not, you're the experts, the audience is the experts. I mean, you guys are the midwives dealing with babies. I'm looking at it from a scientific point of view, from looking at the skin point of view. I mean, certainly I have 3 children of my own, and I probably bathed them within the first week. I probably didn't put anything into the bath because really at that stage, I mean, it's not dirt that's on their skin. You're just giving them a rinse. It's kind of, it's a sensory thing for them as well. So I would say it's minimal, the amount of product you need to be putting into water. Warm, tepid water alone would probably be sufficient.
And it's important for mums to know that, because I think in the olden days, certainly when I trained as a student midwife, there used to be this whole, you had a bottle of baby bath stuff that you squidged in. The more the better, really. And nowadays, of course, we know the least the better.
Yeah.
And in a way, from your presentation, Emer, I've jotted down a peck of dirt, which is an old saying, a peck of dirt, does you good. And it sounded really, that's the heart of the microbiome. You need some of those bugs or bacteria around to keep you healthy.
Yes, and like people with pets in their households, that's a good thing, because you're sharing your microbiome with them, and as long as everybody's healthy, that this is a good thing for people to have this bacteria on their skin.
Yeah, that's great. Yeah. Okay, I've got another question from Gillian McKelvin. Hi Gillian. Maybe a question for Emer. Apart from using gentle wipes, how else can we educate women to protect and promote the natural skin microbiome?
I suppose they don't, women or mothers, parents, even caregivers, they don't need to use all of these products on your newborn baby. I mean, your skin is you're born healthy. And, if you keep it to that minimal approach, and less is more, like less interference, it's unnecessary. It's only when your hands are actually dirty if you're out in the garden or something and you wash them yourselves, but your baby's not exposed to that dirt as such.
Okay, that's great, thank you. And then we've got Joe DeGuston has come back to say, just a comment, wouldn't it be good if parents took more care of their own skin's microbiome via their new WaterWipes info? Now that's a really good point, Joe, again, because I jotted down something about how do you know your own microbiome is okay? Because there's all this a lot of media information. You've got to, use your scrubbing stuff, face creams, and all manner of things to make your skin better. And yet it's obviously got its own natural protection. I don't know if you'd want to comment on that or not. Maybe I've taken.
I suppose that's where my comment was on the increase that people are seeing in sensitive skin, and sensitive skin types are more prone to kind of microbe infections. And so is the sensitive skin a consequence of this overuse of products that have been bombarded, like on facial products for adults for the last decade? And now they're only realizing that, no, maybe that's not the right approach.
This can be an interesting area for research. Actually, one thing I meant to ask, again, I've got it jotted on my bit of paper, for this foundation award, it's opening next week. When's the closing date for it?
22nd of November. So
22nd November. Okay, we have to remember that.
Open for 6 weeks, and the winner not only gets a little trophy, I suppose, but they get a bursary for their ward or unit to put towards, you know, bettering the facilities for either the staff or the parents that they're looking after.
Now that's worth going for. That is worth going. So check out the webpage and have a look at the award and see if you know anyone that could merit that in your unit, because there's so many good. I think the difficulty is going to be, from WaterWipes' point of view, is going to be sorting through the submissions, because there's so many great things going on. Our midwives are so creative. Fantastic out there, all of you. Okay, I've got a query from Lola Ornato. Hi, Lola, how are you? She is saying, could I ask what your views are on vaginal seeding, as in women having elective cesarean sections are asking for it? They're often told no. Are there any risks to this? Are there any genuine medical reasons to deny them the seeding? And I know you talked about that first thing, Emer.
Yeah, I mentioned that in one of my slides, because there is evidence to suggest that regardless of the way the baby is delivered, by 4 weeks, the microbiome is the same or comparable to a vaginally delivered baby and a baby delivered by C-section, but that the jury is kind of still out on whether vaginal seeding is a successful thing to do. And there are only maybe 1 or 2 studies that are robust enough to show that, yes, there is evidence to support that technique. But I don't believe there's enough evidence out there yet on it.
Okay, it would be useful. I think these studies might be available after this evening for people to access. So I think
everything's referenced on the presentation.
Fabulous. Okay, and Abby Tapley says, thank you for this session. What advice would you, this is a good question. What advice would you give to parents who cannot afford WaterWipes? Or wipes at all, because they all have a cost. And of course, at the moment, it is money is a worry for a whole lot of people, isn't it?
That's it. And I suppose people have to live within their means and access products, you know, that they can. We know that WaterWipes are a more expensive product, and that's because of, you know, the manufacturing costs that go in and the research that goes into making the product what it is with the minimal ingredients. I suppose, you know, in terms of what we've discussed today with the impact that different ingredients can make, perhaps they would be better to, in that situation, use cotton wool and water, you know. But you know, it's obviously the individual's choice, and again, you know, being able to access what's available to them.
I mean, I was thinking, as that it's a very good question, Abby. And maybe this is something one can suggest, because I know whenever a friend has a baby, they get given loads of baby grows and all sorts. And maybe what you need is sort of products that are nice, not just for the baby, but in this case, you know, you could do a little bundle of baby wipes and then maybe something nice for the mum, for her microbiome in a package, because often mums get forgotten. So that's a good point. Okay. And then Gillian McKelvin again, back again, Gillian. She says, I always advise less is more. You do not need nappy cream unless there's a problem. Is this in line with your research to just minimize products? I think that might be one for Emer. With nappy cream. This is nappy cream. Look, less is more.
Well, yes is more, unless you have a problem which you then need to go and seek medical help for. So whether that's going back to your GP and, you know, you don't ever, I suppose, try and fix it yourself. If you need to medical intervention, you buy the creams that are suitable. I mean, WaterWipes are not a medical product. They are a cleansing wipe that help against the causes of nappy rash, but they certainly don't cure it or treat nappy rash. And so, yes, you would have to go and and buy those products if your baby needed them.
But I think, and I think what's important when you're educating mums is making sure they don't just slap on the cream without cleaning the skin first, because of course it's the urine and feces that actually make the skin sore or add to it, as it were. So it's part of this is about educating mums about the care of their babies and the principles, like not leaving the baby in a nappy for hours and hours and that sort of thing, because some mums are going to be very clued up about it and some aren't quite so, if they haven't had so much to do with babies.
Exactly, yeah. And educating them as well, like if they're using cotton wool and water, if they're using WaterWipes, baby wipes, to allow the area to dry before putting the nappy back on as well, because that can impact it as well if you're putting the wet bottom right back into the nappy. So to even pat dry with a piece of tissue or piece of cotton wool can help as well.
Yeah.
And that's probably difficult because of course now at the moment everyone's very stressed and doesn't have as much time maybe to spend talking to mums about this, but it's something that's very important. So that,
and then some babies are just prone to diaper rash. I mean, 1 in 4 babies experience it. I know of my 3 young children, one of them never got it and the other 2 always got it. I mean, so, well, they didn't always have it, but I mean bouts of it every so often. And like, this is part of life, and every baby's different.
Yeah, absolutely. So the eco-friendly bit, that is a new one, slightly new, isn't it? Moving to the compostable.
Yes.
I mean, where are you going to go in the future, do you think, with WaterWipes?
Oh,
that's just a small question.
I don't know if either of us are on if either of us are high up enough to know any of that, to be honest.
You'd have to speak to our innovation team, I suppose.
Well, that's, I guess, what's exciting, because to think about it, really. No, that's great. I mean, maybe it's going to be about I don't know, facial wipes for the mums as well. To move to their microbiome, because that's a really good thing. Okay, I have another question coming through, and which has made sure you've escaped from the now what would it be called, blue sky thinking or something? I don't know. No, it's even higher than that, isn't it? Claire Dale says, do WaterWipes have literature that's easily accessible as to the benefits of WaterWipes if people we care for ask? And I think the answer was
absolutely, yes. We have our WaterWipes website is really user friendly. There are, if parents are looking for information, it's really easy for parents to access and find information there. But we also have a dedicated healthcare professional or healthcare section where nurses, midwives, all healthcare professionals can access it. We have information on both of like information that you can print off and provide to parents about not only about the ingredients, but about looking after your baby, about nappy changing. There's for babies in the neonatal unit, there's information there. And also we actually only recently launched our healthcare academy, where healthcare professionals can access the website to do CPD based courses. We've got 3 different courses, one on kangaroo care, one on the looking after newborn skin, and then another one about looking after preventing nappy rash. But each of them, there's 2 that are worth 1 CPD point, one that's worth 2 CPD points. So there's lots of information there, and I would recommend, that you have a look at it if you're interested in learning anything more about newborn skin, really.
Okay. Oh, that's really helpful. I mean, I know there's an enormous amount of literature there available, and it's nice that you can access the actual article rather than have it, because I know that in some literature, when you go looking for it, you try and get into the link and it says this will cost you $20 or whatever, and for some of the closed literature, and I know it's very available and it's all very well organized to access. And the kangaroo care, I'm liking the sound of that. That sounds really interesting too.
Yeah, it's really interesting because it goes back to like how it all began, how they started, you know, to bring it in. And then it also discusses and it offers tips on how to do kangaroo care in difficult situations. So we know how sometimes those neonatal units can be super cramped and things like that. So it offers healthcare professionals like different guidance on how they can support parents in doing what's such a valued moment with their baby, particularly in the neonatal unit.
Yeah, absolutely. No, that's fantastic. Well, I want to say a big thank you to Claire and Emer for joining us this evening, because this has been fantastic. I hope everybody is watching has got a different viewpoint of the microbiome, and it's maybe made you think about going and having a look at some of the literature, because obviously Emer and Claire have given you a kind of edited highlights, because this area is quite big, and there are lots of questions, and there's also lots of answers on that webpage. So do go and have a look, and that's available, and you'll have availability of all the slides after this evening. So that'll be fantastic. Some of us might go on to social media just to answer any questions if you're a little bit late, because I know there's sometimes a bit of a time lag, because sometimes people are so involved in the discussion they forget to put their question in. So if you've been a bit late, we'll try and keep up with you. So again, thank you to Emer and Claire. A round of applause. Now, next week we've got a session on continuity of care, and it's kind of the bigger picture of continuity of care. So I'm really delighted to have Dr. Tracy Cooper and Professor Trixie McAree and also Nat Corden to be with us next week to discuss that. And so in the meantime, stay safe, stay well, and look after yourselves and all your loved ones. Give everyone an extra hug, because I think it's really important at the moment. We've learned what's really important over this year and a half. And also, don't forget to book. You've got the Scottish Festival coming up in I think you said September, in November. You've also got the Student Experience Festival on the 10th of November, and the Midwifery Education Conference also the 10th of November. So don't miss out on those, whatever you do. And also check out the Practicing Midwife. They're offering a very special deal with a student starter package. And if you subscribe, you get one of these, and you also get a knitted breast and the journals and a book, and it's fantastic. So do check it out. And in the meantime, that's it for tonight. We'll see you next week, same place, same time, and take care of yourselves. Thank you, Claire and Emer, once again.
Thank you.
Thank you. Thanks.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.